To a new collaboration with Tucson Fire, you may experience a faster and more effective responses when calling 911 for a medical situation.
News for Tucson's Isabella Fredrickson joins us live from the fire department with more on this new initiative. Isabella.
Sean, Angelique, Tucson Fire tells me that this new collaboration between TFD, the Public Safety Communications Department, and MD Ally Telehealth, their medical responses to 911 calls will be both faster and more effective.
Earlier today, Tucson Fire announced this new strategic collaboration with the Safety Communications Department and MD Ally Telehealth to enhance patient care within the 911 system, something Tucson Fire Deputy Chief of Operations Barrett Baker says is necessary.
Last year was the busiest year that we've had with Tucson Fire, running over 103,000 calls. About 86% of those were medical in nature. And when we talk about medical in nature, there's a very, very wide range of that type of medical call.
Baker says while many of these calls require immediate medical attention, such as a stroke or medical emergency, other calls needed medical help but not immediate care from a first responder. An example would be someone who needs medical attention but cannot get a doctor's appointment, or someone who needs transportation to get to a doctor. Others may require another resource, such as a nurse practitioner or mental health crisis professional. Baker says with this new technology, getting patients the help they need is now possible.
We can get a doctor to a patient rather than a patient to a doctor.
The new technology will allow 911 dispatch operators to connect a caller to the right resource depending on the nature of the call. This would include connecting a caller to an MD Ally telehealth operator or emergency services such as TPD or TFD. Not only will this help the patients making the calls get a better response and faster, but it will also help those on the other side providing service.
This is an invaluable resource to physicians, nurses, paramedics in the hospital, where every day we struggle to manage the volume of patients coming in. This helps take a little bit off of it through an alternative pathway that, quite honestly, is better for the patient.
Officers tell me when someone makes a call, they can expect the operator to ask them a series of questions to best understand which resource to connect them to, given the medical situation. Reporting live in downtown, Isabella Fredrickson, News 4 Tucson.